Hi, good morning, Doctor. My name is Amor of Philcare Pharma, a Filipino-owned national company that specializes in anesthesia, anti-infective, and critical care. I am here to introduce to you a new path of MRSA management that is less toxic and more convenient to use, our Imtec teicoplanin. According Imtec is contains 400 milligram lyophilized powder for injection that is equivalent to not less than 400,000 IU with one ampule with one 5 ml ampule for sterilized water for injection. It is given intramuscularly, intravenously, both in bolus and IV infusion. According to Center for Disease Control or the CDC and Prevention, antibiotic resistance continues to be a public health threat worldwide. So as early as 1945, in the Nobel Prize of Acceptance speech of Alexander Fleming, who discovered the first antibiotic, which is the penicillin. He said, then there is the danger of the ignorant man may easily underdose himself and exposing his microbes to non-lethal quantities of the drugs make them resistant. He was able to anticipate that the world is facing the antimicrobial and MDROs. A common example of this is the methicillin-resistant Staphylococcus aureus or the MRSA, which became evident in 1961. This kind of MDROs are the bacteria that that cause infections in different parts of the body. It is tougher to treat than most stuff like Staphylococcus aureus or staph because it has a bacteria that commonly use antibiotics like methicillin, penicillin, amoxicillin, oxacillin, and cephalosporin. But great news! For the first time in the Philippines, there is now a better alternative of surgical prophylaxis and MRSA management, our Imtec teicoplanin. Imtec is an antibiotic used in a bacteria that cause of gram-positive caused by MRSA and Staphylococcus faecalis. Teicoplanin is a semi-synthetic glycopeptide. Its mechanism of action is to inhibit the growth of suspicion organisms. And according to the study of Stevitsky in comparative of efficacy and safety of vancomycin over teicoplanin is that there was no difference between the two, but there were fewer significant of adverse effect, which is the nephrotoxicity is much lesser frequent with teicoplanin. And also teicoplanin has no case of Redman syndrome compared to vancomycin. Aside from that, in additional studies of Harding is that the comparative pharmacokinetic is that teicoplanin versus vancomycin teicoplanin makes more convenient and for the MRSA management options, medications. And with regards to administrations and dosage, is that for adults and elderly, the loading dose is 6 milligram per kilogram, and IV IM infusion administered 12 hours apart of 3 administrations. The maintaining dose is 6 mg per kilogram, IV and IV infusion once a day dosing. For severe infections, the loading dose is 12 mg per kilogram, IV and IM infusion administered 12 hours apart of 3 to 5 administrations. The maintaining dose is 12 mg per kilogram, IV and IM infusion. The maintaining dose is 12 mg per kilogram once a day infusion. And for children, the recommended dose is 10 mg per kilogram every 12 hours for the first 3 doses. And to discuss what I have to summarize what I've discussed earlier is that Imtec is the better alternative of surgical prophylaxis and for MRSA management because it has a less nephrotoxicity. And Imtec is no Redman syndrome adverse event. And most especially, Imtec is more convenient for administration and dosing. And aside from that, Imtec is cost efficient with a catalog price of 1,950 pesos only. And finally, Imtec is the first in the Philippines and exclusive distributed by PhilCare Pharma. And it successfully passed the bioassay test and carefully evaluated by CEDRES. And it is manufactured by SRS Pharmaceutical with WHO GMP certified and FDA Philippines approved facility. And once again, doctor, I hope you could consider our Imtec teicoplanin for your better alternative of surgical prophylaxis and MRSA management. At least 3 to 5 of your patient per day. Thank you for your time, doctor. Again, I am Amor from PhilCare Pharma.
Okay.